Welcome to Beyond the Exam Room University. I'm Dr. Bonnie Simpson Mason, your president of the university, and I'd like to just give you a little bit of instruction on how to use our courses, our coaching opportunities, and how to attend our live events. On the website, you will see that we have 3 buckets for you to choose from. So if you are a doctor in training, meaning you are a medical student, or professional student, maybe you're a resident or fellow, I want you to choose that bucket because I've created some customized courses for you within that bucket that I know you will benefit from based off of my own experience, pain, torture, and having to make these career transition decisions without the right tools on how to do so. Maybe you are a physician in practice, a doctor in practice. It doesn't matter what year of practice you're in, what types of patients you're seeing, or what type of clinical care you're rendering. There are some core courses that all physicians need to take, and a core set of understandings that we need to have in order to establish our foundation so that we feel secure in making some of these non-clinical decisions regarding our careers, our business or practices, our finances, and all of which affect our families. So click on that bucket if you're a doctor in practice and look at the wide array of courses that we've designed just for you, and I'll be adding a new course probably, if not every quarter, more frequently. Finally, if you're like me, if you are a doctor in business, Finally, if you're like me, a doctor in business, it doesn't matter what type of business you're in. And I've owned at least 4 different types of businesses over the past 18 years. I can't believe that sometimes. But in fact, if you are a doctor in business, there are some fundamentals that we have to understand about making sound business decisions so that we don't end up making financial detriments or bringing financial detriments to ourselves. So please take a look at the Doctors in Business bucket and all of the courses and coaching opportunities that we have there for you. Again, I'll be adding new courses on a regular basis. I can't wait to hear what you have to say, what you think, and to get your feedback. And if there's a course that you would like to see, I am committed. It is part of my mission to keep building. I'm a builder of resources. I'm a connector of my doctor colleagues to the resources that you need. Beyond the Exam Room University is part of that set of resources for you, which is meant to be an umbrella of opportunities for you to get this information. So if there's a course you'd like me to build that you don't see, let me know and I will do my best to build it or find the faculty members that can do so. And if you have a specialty course that you would like to include in Beyond the Exam Room University, by all means, contact me and let me know so we can get you on board as a faculty instructor as well, so that we can get you on board as a faculty instructor as well. Thank you so much. Let me know if you have any questions. Look forward to getting your feedback once again.